Evangeline? Yes. You can unmute your mic. Yes, go ahead.
Good evening, everyone. It is truly a pleasure to welcome you all to today's session. We have a remarkable resource person with us who have made significant contributions to the field of mental health. It is an honor to introduce Dr. Ranjit Rajkumar Devanand, a distinguished clinical psychologist. He is currently serving as a consultant clinical psychologist and head of the Department of Psychology at Atma Hospital, Trichy, and also working as a consultant clinical psychologist in Intact Special School and Pravag Autism Special School. With years of experience in the field, he has dedicated his career to understanding and improving mental health through both clinical practice and research. Dr. Ranjit is not only an experienced clinician but also a dedicated researcher. He has contributed to several key areas, including mental health and women, well-being among young adults, and suicide prevention in industrial work environments, work-life balance, and many more. His research and public talks have provided valuable insights into these crucial topics, making a meaningful impact on both academic and professional communities. Without further ado, I extend a warm welcome to Dr. Ranjit Rajkumar Devanand, sir. We are honored to have you with us. Good evening, sir. Welcome.
Good evening, Ma. Thank you for the nice introduction on me. Really, I'm very happy to be part of this very beautiful diploma program, which is organized by college and the Department of Counseling Psychology. Really, thanks to the HOD and other faculties has given a beautiful opportunity for me to enhance my skill and what I learned. I share my knowledge to the people. Really, I'm very happy. Thank you. Sir, the PowerPoint is there?
Just hold on, sir. I'm experiencing some problems. Sir, you go ahead. I'll come back to you. Yes.
Yes.
Yeah. You go ahead, sir.
Okay. Just a minute. Dear friends, today we plan to discuss about psychological disorder, which very much essential to understand before giving any therapeutic interventions. At the same time, you should aware about the basic psychological disorder, which is very prevalent in our common psychiatric populations. Before giving any type of counseling and any psychotherapy sessions, we need to detail evaluation to understand the clinical background, to understand the etiological of illness and their comorbidity. For that, we must aware about the psychological disorder. Now, we thought to discuss about the various psychological disorder, which is very common in our populations. So before going to discuss about the psychological disorder, we should understand what is mental health. Everybody have mind. but how we are utilizing our mind in a resourceful manner. Further, according to the WHO, state of well-being. So everybody need happiness. For that, enhancing our happiness, to finding the root of happiness, we apply our component. The mind is consist of three things: thought, emotions, and behavior. With these three domain integrating to create the well-being within us. At the same time, how the person is handling in day-to-day stress. So is adjusting with the day-to-day stress, how is improving his coping mechanism to handle our day-to-day stress. At the same time, the person, everyone should have certain abilities. The person should understand the abilities. That ability and skill make the person to handle our day-to-day events and day-to-day stress factors. Not only we learn the skill, at the same time, we productively contributing for the self-development as well as the community development. If these things are there, these things are contributed to develop the well-being on the individual. These three things are available, then our mental health is good. One is coping our day-to-day daily stress. Second one is realizing one's own ability and learn to work on that and try to contribute to our community. This is our mental health. On the same time, if you're talking about the mental health, at the same time, you should understand our mental illness. So how the person is getting mental illness. So already I told you, the mind is three component: the emotions, thought, and behavior. So when there is a change in the emotions, either the person is, we can say positive emotions and negative emotions, happiness, joyful, sorrow, fear. These emotions has been changed when the person is not coping with the present day-to-day daily stress. When the emotions change, automatically the thinking pattern also change. If the thinking pattern change, the behavior is change. If any events or any stress which is not coped by the individual, the emotional area will be disturbed, the thinking pattern is disturbed, the behavior pattern is disturbed. When these things are collapsed, the person may lead to sort of mental illness. We are talking about the mind and mental illness. We should know about what are the different type of psychological disorder. If disorder is different, dysfunction is different. Any person have psychological distress. It may be certain things we are expecting that we not be get it back. So the person may be frustrated sometimes. Certain things we are facing failures, certain demands knowingly, unknowingly crossing us. It gives a lot of distress. That distress can be managed by individual. It won't be lead to disorders. When the distress for a long time not understood, not managed, not try to overcome, that create a lot of biological changes within us and psychological changes within us. That cluster may lead to psychological disorder. So when you talk about the psychological disorder, I am making it as a part one, part two. Today we are discussing about the part one disorders. The part one disorders concern is number one, neurodevelopmental disorder. Number two, anxiety disorder. Number three, depression. Number four, bipolar disorder. Number five, post-traumatic stress disorder. Only these five disorder we'll discuss now. Remaining five disorder, tomorrow evening we'll go to part two. So now come to the developmental disorder. So we all know from the conception to development of the child, the conception itself have certain changes in the development aspects of the child. That is called neurodevelopmental disorder. The neurodevelopmental disorder is neuro is concerned especially on the brain and neurosystem. There is a problem in the brain and neurosystem. There is a lot of difficulties in that. Difficulty in language and speech, difficulty in motor skills and behavior. Not only in that, sometimes the person have a problem in the memory. If the memory and neurological component are disturbed, the learning may not be acquired. So it have an impact in the day-to-day daily activities. For day-to-day daily activities, people should learn, communicate, and behave. If suppose this will be a disastrous changes, the person may have neurological complication within the persons. So what are the reasons for neurodevelopmental disorder? Lot of research says that one thing we should all aware about the chromosome abnormality. The trisomy 21st chromosomes have certain impact, and that the neurological impact will be more in the brain development. Another one is common symptoms like seizure disorder, and then we should exposure to the other chemical substance. If the mother carrying a baby, the mother is exposed to the other chemical substance, sometimes the maternal deprivation, maternal stress lead to lot of changes in the development of the child, growth of the child. That may have a neurons problem in the brain. Sometimes the cortical area, there is a one part in the brain, cortical area, have decreased in the size or increase in the size. The neuronal abnormality will be more on that. Because of this problem, the child, the brain development may not be fully developed. So other thing is other environmental factor. Some environmental factor also may have influence on the brain development of the child, especially suppose the maternal period, the mother is exposed to alcohol, tobacco, and any illicit drugs. This intoxication, this chemical will have a negative impact on the growth and development of the child. Sometimes the child low socioeconomic status. What is the low socioeconomic status? The preterm birth, low birth weight, and the lack of nutrition on that. These factors may have influence on the development of the brain. So with this neurological, with these neurons have a lot of damage on that, there is a lot of neurodevelopment disorder there. One is, we all aware about the intellectual disability. Another one is communication disorder. Another one is autism spectrum disorder. Another one is attention deficit hyperactive disorder. Then specific learning disability and motor disorder and other neurodevelopment disorder. These are the disabilities, these are the disorder mainly focus on neurodevelopmental aspects. If the child will expose to biological genetic abnormalities and neuronal abnormalities, the child may have above reported disorders, either intellectual or communication disorder, autism, ADHD, specific learning disability, and motor disorder, other neurodevelopmental disorder. We'll go one by one. First, we'll look at the, just a minute, excuse me, just a minute. First, we'll focus on intellectual disability. In the beginning, it has been called as mental retardation. Now the mental retardation term has been vanished. Now it is called intellectual disability. The intellectual disability, definition of intellectual disability is impairment in intellectual function. We all know the reasoning ability, which is very much required for our managing our day-to-day events. That reasoning ability may have an impact on functional aspects. There is a limited in adaptive behavior. We all know adaptive behavior, our daily activities. Daily we are doing brushing, walking, washing, reading, standing, running. This is all the adaptive behavior. These intellectual disability people will always have a limitations. They will not be do all the things when compared to the normal people. They have a limitation on that. At the same time, sometimes they need help from the people. It has been initially occurred before 18 years. If more than 18 years, the person have poor in understanding and comprehension, it may have some neurological problem or it may have head injury like that. But here is, if you diagnose the intellectual disability, the occurrence before the age of 18. One is very important, the impair intellectual functioning, the reasoning ability, calculation, mathematics, executive function, these are the intellectual component. This intellectual component will be impaired. They have a limited in adaptive behavior. Day-to-day daily activities, they have depend on others. This is the definition of intellectual disability. Say, if you, in the intellectual disability, we have four classifications. One is mild intellectual disability, another one is moderate, another one is severe, last one is profound. This is the first mild mental retardation, mild intellectual disability. This can be classified by doing a various psychological assessment. It's nothing but intellectual assessment. There is a lot of intellectual assessments available from the birth to old age. Based on the appropriate relevant test used according to the age, what the administration, the intellectual assessment, with the getting of score, based on that, we classified into mild, moderate, severe, and profound. This mild category, the mild category always a educable group, but they need assistance from special educators. The moderate intellectual disability are trainable group. So sometimes they were fit for the vocational training program. It is not in the normal stream. The other two is severe and profound. This severe and profound category is more custodial care. This can be classified by various psychological intellectual assessment. So when the person is diagnosed as intellectual disability, already I told you, certain area, they have limitations. Now we focus on, if the person is intellectual disability, what are the area can affect the person, how that this component will make the person to be more deprived. One is learning. We cannot expect a common learning from a normal intelligent people. We cannot compare on that. Learning will be very less. Then the storing memory, the events which is stored, recent memory, remote memory, these all will be come down. They cannot be solve their own problems. They always need assistance from others. The planning, they cannot be planned. As we normal people, sometimes we plan on that. We plan, we organize, we execute on that. Those people who are intellectual disability, their planning skill will be very less. Then social skills, they will not be go to the society, they cannot mingle on their own because they are hesitation, they are withdrawn, these things will be happen. So that they cannot go for a social skills. But when the intervention, social skills can be given with some limitations. Then sometimes these intellectual people may have cerebral palsy, seizure disorder. These are all comorbidity. If this comorbidity will be more on that, the person have more limitation to do their daily activities. Sometimes intellectual disability people may have other disabilities like visual impairment, hearing impairment, like that. Sometimes the intellectual disability people
Sir,
will have ADHD, sir.
excuse me. Can you see the screen now?
Yes, sir. Yes, sir. Yes, sir.
Okay, which slide you want, sir?
Intellectual disability may affect. Next, sir. Next, sir. Next. Next, sir. Next, sir. Next, sir.
Yeah.
Okay, sir. This one, this
Yes,
one.
yeah.
You can, dear friends, you can utilize that PowerPoint where we are discussing about intellectual disability may affect. Learning, new learning may not be acquired. If you already learned, that will be more difficult to relearn on that. Then memory part, the remote memory, recent memory, these things will be absent. They may not be solve their own problem. They may not be think, they may not be execute, they may not have the planning skills. Then other cognitive skills, social skills, communication skills. Sometimes this intellectual disability is called developmental disorder. They have limitations. So with these limitations, they get assistance from others. At the same time, these intellectual disability people may have other comorbidity, other impairment like cerebral palsy, seizure disorder, vision impairment, hearing loss, and ODD factor. Then very important thing is sometimes predominantly ADHD will be more predominantly in the intellectual disability children. Okay. So how will we evaluate it? Whether how we can observe under it. There is some screening things which is available, but with this screening we cannot be concluded. But that child will be undergo a psychological assessment. There in the clinical psychologist or psychologist may aware about all the psychological assessment. They administer and get the score. Then only they can be finalized whether the child is intellectual disability and different type, whether mild, moderate, and severe, profound, based on the score on that. So there is a sign and symptoms. It maybe we can keep it as a screening point. Delay in language and development. These things we can get it from the mother or the primary caretakers who is nearly 2 years, 3 years since the child. People are taking care. Those people are the primary caretakers, but very well aware. The parents are very much aware. Better we can get an interview from both the father and mother. That will always safe. Because sometimes mother may not be aware, father may aware. Sometimes father may not be aware, mother may aware. These two of them collaboratively saying the information, we should check it out. We should have a checklist also. Checklist also available. That is called developmental screening test is available. Then Winland social maturity scale is available. Sir, before slide, sir. Before one. Okay, sir. Thank you, sir. So how we can get delay in language development? If you inquiry on mother, the child when produce sound, when it meaningful words, when is called mom, dad, or uncle, tata, party, போன்ற விஷயங்கள், we can get it from that. Then suppose parents may not be aware about that, but you can get some other family members on that. So sometimes every culture, every family have certain rules and regulations that child may not be aware about, may not be learned on social rules. They have a trouble in learning specific object, specific learning on that. Have trouble in solving the problem, lack of social incubator, lack of self-care skills, persistent and infantile behavior, unable to take higher education. Because these are the signs and symptoms of, if these signs and symptoms are present in the individual, you should aware about the person may have a possibility of intellectual disability. That has to be confirmed after the intelligent assessment on that. So here is next slide, sir. Here is certain data I am giving. So mild, moderate, severe, and profound. IQ range mild 50 to 69. This is DSM-4. ICD-10 70. Moderate 35 to 49. Severe and profound 35. Profound is less than 20. So if the IQ is, if the person is mild, the ability self-care is independent. When come to the moderate, needs some help. Severe, profound have limitation. They won't do all the things. The language in mild is reasonable. Moderate is limited. Profound, severe, profound. There is no. They're not produce any languages. They're not ready to learn the languages. And the same time, reading and writing, mild is reasonable. Already told, mild population are always educable population. When the time spending and special educator, they can very well prepare the individual to up to the certain limitation in academics. Then moderate is basic, that is already told about trainable group. Severe, profound, ADL is highly difficult. The mild people always ability to work. They are semi-skilled work. Moderate is unskilled supervision, but severe and profound is they may not learn anything on that. Social skills, sometimes mild people can normal, moderate, severe, profound, not able. Physical problem very rare in mild, moderate sometimes. Severity and profound, more physical problem. They may not be motor activity. They were congenital abnormality will be more on that. Okay. Next slide, sir. Now the intellectual disability is over. Now we will discuss about the communication disorder. See, for anyone can do, can make it, can grow, communication is very important. When these communications will have any sort of disaster or any sort of disorder, it can affect ability to speak, listening, understanding, or use of language appropriately. If the person have a communication disorder, they don't have ability to speak and listen, understand, and using appropriate languages. These things will have an impact. Definitely, day-to-day daily activities will be disturbed, especially for the academic performance, or especially for any sort of learning. Communication is very important. This communication may not be there. Definitely, the individual may have a lot of difficulties in a day-to-day life. Next one, sir. So, communication disorder, mainly two types: speech disorder. In speech disorder, articulation, voice, and fluency will be disturbed. In language disorder, accompanying other disabilities, independent of other disabilities. When a communication disorder is concerned, speech and language is very, very important. If these things in very common difficulties in a developmental disorder, I already told you, intellectual people, even we're going to see our autism, these children will have a lot of impairment, lot of difficulty in the communication, because of the Broca-Wernicke area in the brain, they may not be developed because of neurological neurons abnormality, neurons inefficiency to pass the neurotransmitters. These things will be very common in the developmental disorders. Next slide, sir. What are the signs and symptoms of communication disorder? The child or individual trouble in expressing thought or ideas. If you want to think something, I want to ask something, I want to know something. So communication is very important. Whatever we think, whatever you know, but may not be communicated properly. So the person will have a trouble in expressing his own thought and the ideas, which is not very clearly on that. At the same time, the person will have a limited vocabulary. They always speak about single words, double words. They never speak about the lengthy word. They never express what they want, what they thought to express. So limited in vocabulary, difficulty in finding the right word. That is very, very important on that. Then stuttering or hesitation while speaking. Sometimes even for stammering, the people are more anxious. They may have on that. Next one is difficulty in understanding spoken language. Whatever we spoke, whatever others spoke, may not be understood than that. Challenges with the speech, sound, and articulation, because sound languages may not be produced properly on that. Changing in the speech, sound, and articulation, difficulty in following direction or conversation. These are all the basic symptom of communication disorder. If the person will have a difficulty in expressing thought or ideas, they have a limitation in vocabulary. They may not be find a right word to produce on that. Sometimes they hesitate to speak. Sometimes they may not be understand other languages. Sometimes they may not be understand the proper sound articulation on that. They have difficulties on that. These are all the signs and symptoms to understand that the person will have difficulty in communication disorder. Next slide, sir. So what are the before slide, sir? Before slide. The before one, sir. Before one. Causes of communication disorder. Sir, before slide.
The slide is
Before
stuck, sir. Just hold on.
Before one, sir.
Oh.
Before one, sir.
Okay, yes.
Okay. Before one, sir. Before one, sir. Yes, sir. Yes, sir. The causes of communication disorder. So one is very common problem is abnormal in brain development. So already I told about neurons. When the neurons, neurotransmitters, those area will have damage, the person may develop communication disorder. That is called speech and language. Especially speech and language is Broca and Wernicke area. If the Broca and Wernicke area is disturbed, speech and language is very much scattered. Another one is being exposed to the substance abuse or toxins before birth. So I told you, the mother who are exposed to the toxins or any toxin, which any chemical toxins, any pollutions, that will have an impact on the growth of the child. When these things will have an impact, the child may have a difficulties in the communication. Then cliff lip or cliff palate, the child may have a difficulty to produce the communication in proper manner. Then genetic factors. Another one is traumatic brain injury. Sometimes with accidents, with viral fever, the communication area will be a damage on that. Then neurological disorder like seizure disorder also will have seizure disorder, stroke. Stroke may have aphasia. Then any other tumor in the brain will have impact on the communication disorder. These are the causes of communication disorder. Next slide, sir. Next one, sir. So what is the treatment for that? We all are aware about the speech pathology. They specialized in this area. When the child have difficulties, the child have developmental difficulties, the child because of the developmental difficulties, child may have a problem in the speech that has been evaluated by the speech and language pathologists. They have certain technique, they have certain therapeutic intervention to improve the speech. Not only for that, even a grown-up people after the head injury, after the accident, any sort of injury in the brain, they may have speech problem after the head injury, post sequelae. We can call as post sequelae. For that also, they take intervention by the speech pathologist. They use certain languages, certain sign, certain therapeutic intervention to improve the communication on that. There may be focus on that articulation practice, fluency training, voice modulation exercise, and language enriched activities. These are all the very briefly I'm explain on that, because this area will be more focusing on the speech pathologist. So our area is what as a psychologist we focus on that, what other therapists can focus on that. We should develop the confidence level, self-esteem, social skills, and the cognitive retraining. There is a one technique is called cognitive retraining method. It is available. That is to be given by the psychologists, those who are having communication problem on that. Group activities, these are all be very much required for that. Then come to autism. So autism, mainly it is a neurodevelopmental disorder. This condition may lead to communication problem, social behavioral challenges. So autism, it is a now it is called the autism spectrum disorder, because pure autism, research says pure autism in 10,000 population only one pure autism. Now recently research says every 100 child there is a 3 to 4 autistic children are there, because it is a neurodevelopmental disorder. It mainly have an impact on communication, social relationship, and behavioral changes. Next slide, sir. So here is autism spectrum disorder. When the child is diagnosing autism spectrum disorder, they have a problem in information processing, the verbal and non-verbal communications. If you have any cue, if you are given any cues, child may not be respond on that. The child will respond on his own on that, because the child may not be aware about social awareness, motor skills are very less. Sometimes the child may have a ADHD symptoms also. Perseverance on thinking, they have a very stereotype, echolalia. These are the features which is predominantly very common in the autistic children. What are the causes of autism? We make it as an environmental factor and patient and family related factors. Environmental factors is sometimes the even parents may not aware about the vaccination in infancy period. Then sometimes their toxins and metal heavy can be exposed. Sometimes pollution can be exposed. This can lead to autistic children on that. Sometimes other causes are sometimes the parents may have a child under old age. Even they don't have a child. Late children may have a vulnerable to develop on that. Some genetic factors. Sometimes gastrointestinal problem in the child. Sometimes prenatal, perinatal complication will lead to autistic child. Next slide. Mainly for autism, sensory areas are there, but the sensory areas may not be integrated on that. They have always problem in the sensory processing area, so that they may not be listen in your sound, they not listen in your action, they cannot reproduce on that. So for that, there is an intervention. Yearly intervention is available. That in the yearly intervention, they go for sensory. There is one therapy is called sensory integration. There make it integrated all the sensory area. With the integration of all the sensory area, the neurons will be reprocessing and come to the normal situation on that. But for that, sensory integration therapy is very much required. Sometimes the autistic children may have some behavioral problem, maybe biting, clapping, uh, uh, ADHD features. This can be modified by applied behavioral analysis. That is called one therapy is called ABA. Then we are all aware about there is a separate curriculum for autistic children on that. Sometimes the autistic children's symptom itself, they have a communication problem on that. Sometimes they will be very active, not goal oriented. If that speech problem can be addressed by the speech therapy, sometimes the comorbidity of autistic children may have ADHD. ADHD, inattention, sometimes they become more aggressive, shouting behavior, sometimes may not be follow our informations, may not be they have a goal oriented behavior. For that, the occupational therapy, sometimes the motor activity, deformity of other impairment, either orthopedically handicapped like that. So physiotherapy is very much required. Apart from this, community networks, very, very important to support the parents who have autistic children for parental training, because the parental stress will be more on that, because sometimes the parent may not be aware about what is really autism, what can be done, how we can improve the skill on the child. For that, parental training very, very important, as well as the parents who focusing on the child development. The parents may have a lot of stress on that. They think lot of burden in their life. For that, stress management, life skills program also required on that. Sometimes these autistic children may not go for early intervention. Some they develop self-talk. This self-talk gradually become worsening. They go for schizophrenia. So later in life, for that they need some sort of drugs. For sometimes the child may not be get proper sleep. If the proper sleep is not there, the child may be very aggressive, very restless, irritability. That became more burden to that. For that, sometimes they need some pharmaco treatment. Either the child may anxiety or some hyperactive depression, obsessive compulsive behavior, also stereotype behavior will be very common in autism. For that, they may require some pharmacotherapy also. That should be looked at by the psychiatrist. Even these are all be done after the detailed evaluation. We have to rule out developmental assessment and the vocational assessment, then social maturity assessment, then rating scale for autism. There is a CARS, RISHA is there. If after the detailed evaluations, once we conclude on that, based on that conclusion only, we go for what type of therapy is required, whether sometimes the child may require drugs or not. It is all a integrated approach. If you want to develop this child, if you want to manage the child, integrated approach is very much required on that. Sir, next slide, sir. Now come to the ADHD, that is attention deficit hyperactive disorder. It is very common in children's. Even you all know that the child may not be sit even more than 2 minutes or 3 minutes. Lot of distraction are there. So if these things are there, the child may have a lack in the learning. The child may not have a good relationship, good social relationship with others. It's always get a name as a troubling child. Sometimes the child trouble himself. Sometimes the child may trouble the environment also. If the child is studying on that school, no, if a child is not sit in the chair, it will disturb others also. So the ADHD is a very focused nowadays. It is a nowadays very common in the children's also, but need to be addressed, need to be evaluated. So what are the symptom of ADHD. One is the ADHD child will forget whatever learned, he or she try to forget. They have a difficulty in a sitting, poor sitting tolerance, always running. If you any toys, if you give the key, the toys is running, still over the energy. Like that, child will always running here and there, never sit in a environment, either classroom environment, even home itself. Sometimes the carelessness, the handling things are very, they may not be handle the things very properly. Keeping the things in a proper place also very difficult. They may not be very organized. They may not be very planning. Sometimes they are missing under. Sometimes giving trouble to others also. So the disorganized, sometimes ADHD children, they have excessive talk. They talk like a mature people, but once we give any task, they never completed. These are all the basic symptoms of ADHD children. So what will happen? See, any child, either autism or intellectual disability or ADHD, we should understand the brain functions. Even parents may aware now is internet facilities are more available. If any doubt, the parents are go to the internet and search all the things. Sometimes this information is overloaded. Parents become more panic. Parents become more anxious. Even they read it some symptoms. They apply the symptoms to the children. They're getting more panic. Even I have a lot of cases. Even they more aware, they become more anxious. They came to us whether my child is ADHD or my child is not listening, not communicating, or whether it is an autistic child or a child is not sitting, whether he is study well or not, what will happen in the future. Like that, so many information are there. But always we should understand, if you want really the child is ADHD or really the child is autism or the child is intellectual disability, we must always understand the brain functions, because every disorder has certain neurological component. See how this ADHD will have an impact on the brain. There is one area, prefrontal cortex. Say this is responsible for organization, cognitive flexibility, self-control, maintaining attention. See, these things are very much required for everyone. Even the person who is doing a business or doing any research work or working or studying, these things are very much required. These things will present in the frontal lobe cortex. Organization, cognitive flexibility, self-control, maintaining attention. When the ADHD children will have certain problem in the prefrontal cortex. Always keep in your mind in the neurological aspects. If these prefrontal cortex have lot of disturbance or any neurons will be damaged, and that the person will fail to organize. They may not be flexible. Self-control is very less. They may not be focused. With this ADHD children will have the problem in that. Then come to the basic ganglia. It is the communication within the brain. It's regulate the communication. Sometimes whatever I communicated to the child never listen. If asked what I said, child nothing. They always are running here and there. They never focus on that. When this basic gangling area, basal ganglia, which is responsible for the motor control, facilitating movement, where to sit, where to walk, what to do, how to write, and incubating competence, competing movement, unnecessary behavioral changes may not be happen. It has been controlled by basal ganglia. With this area, the ADHD children will have a problem on that. So they may not be controlled on that. They are always running. They never stop on that. They never try to control on that. If you are trying to pulling to control on that, always shaking hand, jumping like that, always moving in the hands, foot like that. So it is very much required on that. So always keep in mind the prefrontal cortex, basal ganglia, then the reticular activating system. There, it is the place where arousal and consciousness. So the consciousness, the listening and doing all the things should have a consciousness. This consciousness will have a difficulty on that. See, if this reticular activity system will be disturbance, the arousal and conscious, they may not be responsible for that. So what is the deficiency of that? This reticular activity system will be disturbed. They may not show any attention. They are very impulsive. What they're doing, why they're doing, how they may not aware of it. Whatever they want, they will do it. Whether it gives any impact, negative impact or positive impact, they may not aware on that. Then another one is limbic system. It is more emotional part. The child may get more aggressive, temper tantrums, shouting, the emotional not balanced. They are agitated. Their irritability. These things can be controlled by the limbic systems. So this limbic system will be disturbances. The child will be restless, inattention, and emotional volatility will be more on that. So already told the definitions itself. What are the features of ADHD children? When these features, because of this neurological part, prefrontal cortex, basal ganglia, reticular activity system, and limbic system. Always keep in mind. Why we know this? We should educate the parents. Sometimes parents may thought that because of the father is more pampered, child is doing. Mother against the parents. Sometimes father against the mother. Mother is totally pamper the child. They never allow the child more independent. Say this wrong information regarding ADHD, we should educate to the parents. It is not because of definitely and the behavioral aspects, parental care, parental approach, very, very important. What type of approaches the mother have with the child, the father have with the child. That is very, very important. At the same time, the neurological component also very, very important. If you understand the neurological component, that helps the parent to understand because of the neuronal signal, because of the neuronal pathway, because of the neuron, child will have this kind of difficulties. Once they understand, they never beat the child, never compare the child, never underestimate the child, never emotionally, physically abuse the child. If this thing happen, the child may drop out, child may develop behavioral problem, child may have some difficulties in adjust with the environment, being with the people, understanding people, all the things will be a damage in the future. So every disorder always linked with the brain functions. Next one, sir. So what are the therapies are available? So that is always we know aware about pharmacology therapy, non-pharmacology therapy. One doubt on that. If a behavioral psychologist or behavioral scientist, us, we always prefer the behavioral management of the behavioral therapy. But when you come to the psychiatrist, they also evaluated, but based on that, the ADHD is a mild category, moderate category, severe category. There is a lot of scales. That scale administered to the parents, another scale administered to the teacher, another scale administered by the therapist. All the three score together and make a nominal score. Then we categorize whether the child is mild ADHD symptoms or moderate ADHD symptoms or severe ADHD symptoms. If the child has severe ADHD symptoms, sometimes the behavior therapy will be failed on them. So that time we need small dosage of drugs. Always keep in mind, small dosage of drugs. Apart from this, behavioral aspects will be trained to them. Sometimes the moderate ADHD or mild ADHD, they may not require medications. They always go for behavior therapy behavioral analysis, where the child will be more stimulated. What are the pampering method? What are the child rearing practice within the family and within the parents? This also have an impact to making the child to be more versed on managing the child and behavioral aspect. So behavior therapy is very much required. Apart from behavioral therapy, there is a very much required social skill. How to play, how to interact, how to share, how to communicate it, all the things which is very much required for the child. So social skills very, very important. Another one is parent. Parent is the main co-therapist for us. So we train the parents. We train the parent not show your emotions or not showing any aggressive toward the child, because the child not doing knowingly. It is he or she is unknowingly doing for that because of the neurological component. Already we studies on that. At the same time, any environmental factor. In environmental factor itself, sometimes when child become more activated when in the room itself, because nowadays the people are trying to control the child behavior giving gadgets. That is another problem for that. At the same time, no proper schedule in the home, reading time, playing time. Sometimes parents more prefer only for reading, not allow the child to be play, because play method is very much required on the child. If the child is play 1 hour, the research say 10 minutes attention increase. The child play 2 hours, 20 minutes attention increase. At the same time, the school also should understand the neurological component of the child. Then only the education aspects, educational area, the teacher environment will support the child to improve in the ADHD condition. So for that, we need a team of work. Parents also understand, therapist should be there. Other times when there is a need of drugs, go for a drugs, then academic, based on the academic. Because sometimes the teachers may prefer the child more than 40 minutes. The child may not be sit more than 10 minutes. For that, the play method is very much needed for the child. So if you want to develop the child, the parents understanding is very much required. Then teachers understanding very much required. Curriculum also based on that. If these things are more supportive, then the child can be easily manageable this ADHD symptoms. Sir, next slide, sir.
Sir, can you take up some questions now?
Yes, sir. Yes, sir.
ADHD is over?
Yes, sir.
ADHD is over, or is one more slide?
ADHD over.
Over, okay. Then what I do, I stop sharing and we can take up some more questions. Yes, yeah.
Yes, sir.
We have some people already raised their hands. Now we start with Shubha. Mr. Mohan, could you unmute the mics, please?
Sir,
Yes, thank you. Yes, ma'am, Shubha.
Please, madam, welcome, madam.
Sir,
Yeah, unmute your mic.
can you hear me, sir?
Yes, yeah, yeah.
Yes, madam. Yes, madam.
Yes, sir. Sir, I'm having doubt in autism, sir. Sir, as in your lecture, you said autism, the vernix area in the brain will be affected. So, is there any confirmative diagnosis like MRI or CT scan can identify the affected area in the brain for autism children, sir?
Yes, yes, madam. Yes, madam. The prefrontal cortex, amygdala area, they have a neurological impairment on that. There is a lot of research that say that. Yes, it's available, madam.
And my son was diagnosed as autism, sir. And he is 13 years old. And recently we took the MRI brain and it is says completely normal. And IQ level, how whether it will be low or not, whether we can able to find in autism children, or we are having doubt whether really he's having autism or IQ disability.
Even for your information, madam, we lot of neurologists refer to us. Okay, if you take CT scan, everything is a normal.
Yes, sir.
The parents have doubt. If the brain MRI shows the brain structure,
Yes.
in autism, there is a interrelated sensory receptors. There is a problem in the sensory receptors.
Yes, sir.
So sensory organs may not be integrated each other. That part may not be available in the MRI.
Yes, sir.
But a functional MRI, I saw a lot of research. Functional MRI, it shows certain things. But functional MRI, every parents may not be took it under because the cost is very high. But basic MRI, we took it. In the MRI says it's all normal. MRI shows the brain structure.
Yes, sir.
It is not showing the functional area, the frontal, occipital, temporal, parietal lobe. There is a 4 lobe in the brain.
Yes,
So that part is either structure or not. That shows by MRI. The part is how interrelated. That interrelated, we have that. That is called intellectual assessment. Even all the autism children may not be MR. Even I have few cases. The fellow is now doing
இல்லிதாம்மா அதுல வேற போட்டிருக்காங்க
BA economics in Jamal College.
இல்லிதான் வேற போட்டிருக்காங்கன்னு சொன்னேன்
He is above average intelligence.
போ வரேன் yeah
But we have to rule out that one.
okay. And one more question, sir. The family factors is like the gastrointestinal disorder also one of the factor. So how the gastrointestinal factor will lead to autism, sir?
Because
நீங்கதான் இது பிடிக்காதுல்ல உங்களுக்கு
Hello, those who are not asking questions, kindly mute your mics, please. We will appreciate that. Go ahead, sir.
so the gastrointestinal tract, there is a link between the heart and stomach. If any toxin, the mother who is exposed during the pregnancy, it have an impact on the trach because the oxygen circulation and food circulation and toxin will be overloaded. That lead to brain development of the child.
Okay, sir. Thank you, sir. Thank you.
Yeah.
Yes, we go to Dr. B. Bharati.
Sir, good evening, sir.
Yes, good evening, ma'am. Yes.
So my question is whether depression and anxiety disorder have any positive effect on individual life or they are solely negatively, sir?
For whom, madam? Is you are asking about the general population or any related to development disorder?
For the general population, sir.
Yes. The WHO says that in 2050, psychiatric illness is the first. That is called depression. Depression is a very common disorder when compared to all the illness, especially in developing countries. Anxiety, depression is very, very common nowadays. That is one aspect. Now, anxiety is everyone have anxiety, but it is a clinical anxiety that is different. If you wake up in the morning, how many people are feel very relaxed? If you go to bed in the evening, how many people are happily sleeping? Nothing on that, because that whole day program will come to our mind. Even next day program also come to our mind. How we are managing on that? It is more manageable than anxiety is a common disorder. But in a clinical, I cannot be controlled. Biological rhythms will be altered. Autonomic arousal will be more dominating. Breathing difficulty, suffocation, attention difficulties. Then it became a clinical. Depression also very common nowadays, because our expectations may lead to some frustrations. Okay, may not adjust with the environment, may not where I'm looking or not be adjusted. This psychosocial area will have an impact on the development of anything like depression. If not manageable in a early stage, that will lead to suicidal thoughts. Even sometimes the depression with happens abuse, they lead to a lot of chronic depression, lead to suicide, and then that is addressed by the drug therapy or psychotherapy patients. So nowadays, unwinding depression is very common. Even the early period may not be ruled out. That is doctor term is the counseling after the professional life.
My second question is, sir, can you hear me? Sir, can you hear me?
Madam,
Sir, my second question is
yes, ma'am.
whether the social pragmatic communication disorder is a neurological disorder.
No, madam, not always. Not always. It is more related to the social anxiety. Some of the communication disorder, even stammering, chattering, also can be neurological problem as well as the social issues. Social skills, social anxiety will be more dominated. Basically, will have this kind of things on them. But we have to rule
Sir, we are
out
not
whether
able to hear.
in fact, psychosocial aspect.
Thank you, sir.
Sir, somebody is interrupting. Yes, Mr. Mohan, kindly remove that 30, number 30 from the line. Harshita Shinoy. kindly remove. Yeah. Okay, sir. Yeah. Yes, sir. You can go ahead. Yeah. Ma'am?
Yes, madam. We have to rule out whether neurological problem or psychosocial issues, madam. That to be need to be clear. If before during we can how we can clear it? Any head injury, any developmental abnormality, any seizure disorder, these things can be ruled out. If these things are not happen, maybe we have to check the family pattern, pampering environment or protective environment, whether the child is exposed to the society. If these things are absent, no, definitely it is more related to the social related disorder.
Okay, sir. Thank you.
So we have Prem Lata. Would you unmute your mic, please? And you can ask your questions.
So how can we help a person with a communication disorder as a psychologist, apart from speech language pathologist?
Definitely. First, one thing you always keep, it is not a neurological disorder. There is no problem in the neurology. Then come to the born and brought up area. We have to modify the pattern which is exist in the home. Then we should exposure therapies available, systematic desensitization available. These things can be exposed various tasks that is called behavioral analysis. Then all lead to social skills training. This social skills training very much required for everyone. Even for the young generation, they have lot of problem in the social mingling on that. This social, that is called social intelligence. They have absent in social intelligence, but exposure, behavior modification, relaxation therapy, systematic desensitization, activity schedule, gradually exposure.
Okay, so if a person having a hearing disability along with the selective mutism, how can we help them?
Pardon, ma, make it clear.
If a child have a hearing inability along with the selective mutism and other communication disorder, how can we help them?
Okay, hearing impairment is neurological problem. Okay, then the child have difficulty in communication, it again neurological problem. So for that, we have to go for integrated approach. We need speech pathologist, okay, and the ENT profession, then psychologist and family. This pattern will be integrated and develop on that. Gradually exposure.
In that case, what can we do as a psychologist to help them?
All right. First, we have to rule out whether ENT consultation is done. Then, whether ENT support, hearing aid. where the child is profound impairment. They have the hearing, cochlear implant is available. Then come to the speech therapist. Speech therapists always focus on sound, verbal and non-verbal communication. Then family pattern, integrated play therapy, task-oriented, and exposure to the society. That verbal communication, apart from verbal communication, non-verbal communication is a very good part. The child learn to communicate.
Okay,
Dr.
sir.
K.
Thank you
Tara,
for your
can I
explanation.
ask you a question? Dr. K. Tara, unmute your mic, please. Yeah, go ahead. Dr. K. Tara, are you there online? You raised your hand. Kindly unmute your mic, or we go to the next person like.
Sir, good evening.
Yes, good evening, ma'am.
Sir, can you explain some of the early signs of autism that parents should look out of it?
Okay. So first we have to rule out developmental history first. Okay. Another one is, see whether the child, if you are producing any stimulus, either producing some sound or clapping or touching any stimulus, whether the child is response, nodding the head, seeing eye to eye contact, smiling you, holding you. These things will be absent. Another one is, when producing any sound, child may not be listen. Either it is a problem in the ENT, nose problem, ear problem, or the problem in the integrated or any abnormality in the neuronal integration. These are all the symptoms: stereotype behavior, poor communication, not maintaining eye to eye contact, socialization are very, very minimum level, even 5%. But the child living on his own world, they never touch with the reality, never touch with the surrounding. These are all the basic symptoms.
Vijay, ma'am, could you ask a question, please?
Good evening, sir.
Yes, good
Good
evening.
evening, madam.
How can I help my students or even my child showing signs of inattention?
Okay. See, there is a lot of behavioral activities, madam. Before that, if you want to produce attention on this, we have to rule out distraction where it is happened. Distraction in the home, because we never prefer particular place for study. If the particular place is surrounded by so many things, one side is TV, one side is radio, one side is people are walking, talking, all the things, no? Definitely child may have a distracted, they may not be focused attention. So sometimes this attention deficit children are more hyper vigilant. They are keen observer. Each and everything can be disturbed. Hypersensitivity will be more on that. That for that, blindfolder is one exercise to improve the attention. Another one is choose the place where there is no distraction on that. So the external stimuli can be avoided. Then make a program for a compartmental system. If the child is more than 45 minutes, may not be sit. Make it 10 minutes, give 2 minutes break, and encourage the child, reward the child, appreciation the child. Weekly once, if I have a time daily half an hour, just leave the child for play as his own.
So we take up the final question from yes, Normalar. Could you come on the video, ma'am, quickly?
Good evening, sir.
Yes, good evening. Come.
Sir, actually, I'm an assistant professor and I have engineering background, sir. So while working in my PhD, I worked on speech signal processing, and one of my colleague worked on disorder speech or pathological speech.
So she used to collect the disordered speech and built assistive aids for the people who have pathological disorder. So since I heard all these things, I'm also interested in building such assistive aids. So what sort of aids are required for the people who have pathological speech pathological disorder in particular?
So it is more technical area,
Yes,
which I
sir.
know something I can share it.
Yes,
Okay.
sir. Okay.
So definitely for the verbal communication, they
Okay.
need clear sound, touch therapy, and identification and
Okay.
communication. The word integrated assessment is there.
Yes,
Okay.
sir. Yes.
So these are all three can be mainly used. But even
Okay.
though that area is very less for me, my limitations, but
Okay.
I came to know these kind of things. But as a researcher, doctor, student, you may be aware more on that also.
Okay.
Only
Okay.
this
One
I
more,
can
one more
aware that.
small
Ah,
question, sir.
yes.
Sir, those people, I saw the data she was using. Some people replace frequently with the same phone, the sound, phoneme, I mean.
Ah, ah.
Uh, is that any pattern? We can see any pattern in the replacement of phoneme?
Yes, yes. It is available.
Can we
Uh,
find the root cause of it using the neurological thing you are
yes,
saying?
yes, yes. It is available. It's available.
Okay, okay, sir. Okay, fine. So we can.
Sir, yeah.
Sir, yes, sir.
Shall we take up one more question? Because,
Yes, sir. Yes, sir.
okay, all right, one more question. So this is the last question. Premlata, could you come on your video? Now, why I'm saying that you come on the video, because sir will be able to understand you better. So if you would come on the video, I mean, all those who are coming and asking for questions, kindly come on the videos. Yeah. Premlata, are you coming on the video or releasing only your audio? Go ahead.
But
Are you
yes,
there? Yeah.
sir, how can we handle the child who shows temper tantrum with the neurodevelopmental disorder? Because they will show more aggressive attitude toward the psychologist. In that case, what can we do there?
Simple. In a behavior modification, we have one technique is called timeout technique.
Okay, sir.
Whenever, if you read the technique, which is available in behavior therapy, timeout. Whenever the child is temper tantrums, okay, the environment is what says try to prevent on that. If you try to prevent, that is the child is expressing undesirable behavior. Okay, what people will do? Always aggressive, anxious, and beating on them. So it gives the child will give negative behavior. To strengthen the negative behavior, their parents never give positive behavior. Then they're giving more negative on that. It will be more aggressive on that. So simple, if the child is showing undesirable behavior, we should give negative punishment that is called away from the stimulus. There is a one room, it's called uh, sometimes simple room, put in a chair. Whenever the child is temper tantrum, take the child to be sit in the room and just close the door. That room will be visualized by outsiders, not by the inside people. That is called timeout.
But in the case of autism, they can't understand that science and
No,
all.
no, no.
How can we manage?
See, autistic children, they understand non-verbal communication rather than verbal communication.
Okay, sir.
So this non-verbal communication will be more impactful. Instead of talking 1 hour, half an hour, try to understand the child or try to explain to the child, never understand because never give any stimulus to that. But non-verbal communication, if you addressed, so that's if the child doing something, you just maintain eye contact, blind, not show any emotions on that. If you're showing the blind like this, just spend 2 minutes on the child. Child become very confused what others will do on that. Whenever we do this one, that undesirable behavior will be controlled on that. Otherwise, go for OT. If the child is more restless, OT is very, very important. Play therapy is very, very important. And timeout is very, very important. This is one which is continuously useful in the behavior modification to handle the undesirable behavior.
Yes, sir.
Thank you very much, sir. So
Thank
I
you,
think you had a long day today, and you have covered a lot of psychological disorders, the causes, and the treatment, and the participants had a lot of queries and questions and we have clarified all their questions well. So thank you very much, sir, and we'll see you tomorrow. And ladies and gentlemen, so thank you very much. We say good night.
Thank you, sir. Thank you very much.